Good morning, amigos. Dr. Doug here at BodyTrust.com. Found an interesting article a while back from the BBC. It's about a British surgeon, breast cancer surgeon, who got breast cancer. Isn't that terrible? God, what a nasty disease that is, too. She said, like many women, I did not check my breasts. I thought, it's not going to happen to me. I'm a breast cancer surgeon. This is a woman named Liz O'Riordan, Irish name. She was in this business for 20 years, and she got breast cancer in 2015. So she had a mastectomy, and then last May, it came back. I'm going to show you a couple of pictures of her, and you can see that she's not fat. You know, we often associate cancer with excess weight or obesity, and that is true. And the reason is that all that excess yin, which is material, excess yin gives rise to yin stagnation, because that's what cancer is. You know, a tumor is stagnation. That material is not moving. It should be moving. It should be functioning, but it's not. It's not moving. In fact, it's moving on its own. It's not moving with the flow of the body. It's stuck. And so it builds, and it builds faster than the tissues around it. A tumor, we would call that qi phlegm stagnation. A cancerous tumor is painful. A painful tumor is blood stagnation. That's sharp, stabbing pain. But a tumor, a cancerous tumor, grows out of control, and that's toxic. So we call that toxic blood stagnation. We do have herbs that help with that, and of course surgery can be very necessary. That's an emergency situation, or even a heroic intervention situation. Some people prefer to use herbs and acupuncture for it. I've heard of recoveries from that. But the problem here is that it came back, and that tells me that they have no clue about what causes cancer or breast cancer, except, well, they tie it to smoking, okay? They tie it to excess weight, right? That's about it. They don't know any other causes. Some people say, oh, it's the food, you know, the additives in the food. Well, I don't really buy that. Because if you're lean and clean and your qi is moving smoothly, your body takes care of its tiny impurities like that. And the classics in Chinese medicine, going back 1,000 years, they all confirm that if you're really healthy, your body can handle impurities, because it's a genius. So what's going on here? And of course, she's going around now giving inspirational talks to women with breast cancer, telling them to persevere and what it's like, and creating empathy. But that doesn't stop cancer. So there's two causes that I think might be happening here, but of course we don't know, because I can't question her. And the writers or nobody else will question her on these subjects. One, of course, is bad posture. I can imagine a breast surgeon performing a lot of surgeries and hunched over all the time doing this, right? What does that do to the qi movement in the breast, in the chest? It slows it down, so that the your wei qi cannot go after those microscopic tumors and take care of them. That could be a major cause here. Another major cause, of course, is worrying. When we worry, and I can't talk to her, so I don't know. So, but worrying, of course, creates this tightness, this fight or flight emergency situation all the time in our muscular system. And that also will bring on stagnation and toxic blood stagnation. if you will. So those are two causes that need to be addressed when we're talking about prevention of cancer, breast cancer. A third one is breathing shallow. Now, shallow breathing or holding your breath. If you're constantly holding your breath or breathing shallow, well, then you're not expanding the rib cage. And we need to expand that all the time so that the qi can flow. Remember, your Wei qi, your immune system, your Wei qi goes after these little tumors and kills them. They're mostly protein. So it recycles that protein. See, we want to recycle everything. And that in the chest happens when we breathe. And a lot of people, especially women, not only women, but especially women, hold their breath in this emergency situation, this chronic fear. That has to be let go. We have to breathe all the time and breathe deep. So there we go. Sad story. You can find it. It's from the British, let's see here, it's the British Journal of Medicine. And this is from the BBC, April 20th. So you can look it up. Fascinating story, long story. And I hope it doesn't come back for her. But I'm not getting my hopes up too high. Well, that's all for this morning, amigos. Have a great day. Hasta mañana. Thanks for watching.